I think it helps to think about where the osteoarthritis is, so that for, say, the hand, which is relatively commonly involved, then simple things that can be done are to have implements, whether it be a golf club or a kitchen implement, with wide handles, with thicker handles, as it makes it possible to grip the implement much more easily with less pressure across the joints. If one has pain at the base of the thumb, which is a very, very common site of osteoarthritis, then sometimes splinting for activities that cause pain can be a big relief. For the knee and hip, it's really quite different, and one's going to think about the big risk factors, which is, say, overweight and lack of muscle strength. Being overweight, if you were in the top third of weight, then you're going to have increased your risk of actually getting osteoarthritis 800%. But sometimes losing a small amount of weight, 10 or 15 pounds, can dramatically improve the pain level. The other aspect that's critical is really muscle strengthening. So the leg is supported by the muscles, especially the knee, and the better the muscles that you have there, the less pain you're going to have. Exercises that don't cause a lot of pain are especially aquatic exercises, where the floating in the water takes some of the weight off the knee, and it could be swimming or just an aquatic program, or even just walking in the water, holding onto the edge of a pool, will be beneficial. Other exercises would include bicycling and even things like Tai Chi. Then there are sort of the equivalent of a splint. There are a number of things you can do to help. So there's unloader braces, which are those big, rather expensive braces that are used for the knee to try and shift the weight onto the good side of the knee, as well as simpler things like wedge insoles can sometimes help in the shoes, and taping of the knee, where you tape the knee over towards the inside aspect, and this would have to be done or taught to you by a physiotherapist, can improve the pain. So these are all things that are relatively simple, but for the lower extremity, getting involved in a good exercise program, especially an aquatics one if you're not aerobically fit, and losing some weight is probably going to do the most for you. Yes, younger adults certainly get OA, and in fact it's interesting, we now think that even older age onset OA probably starts around the age of 40. But younger adults get it too, so those under 40. There are individuals who, for some reason, like a congenital abnormality that the joint is not normally formed, will be at higher risk. And there are those with big-time trauma, like a fracture that doesn't heal properly. But those are relatively uncommon. More common are knee injuries, where one has either an ACL tear, where the majority will develop osteoarthritis, even with surgery, or meniscal injuries, especially if the meniscus, which is a little discus in the knee, a little cartilage discus, has to be removed. Those people are going to be at higher risk of osteoarthritis of the knee at an earlier age. It's interesting, we now think that a lot of adolescent sports injuries may predispose to osteoarthritis, even though they're not necessarily severe. So it's not a tear of a meniscus or something like that. But serious injuries where people don't rehab them properly, go back to the sports too soon, may be putting a person at risk of osteoarthritis to a significant degree. This is more true for women than men, and it's especially true for sports like basketball, football, soccer, and hockey. These are sports where lower extremity injuries are common and may result in osteoarthritis later on. There aren't really great support groups or resources focusing on young people, although fortunately in Canada, increasingly groups like soccer associations are getting much more involved in better training of coaches, that well-trained coaches can make a big difference in preventing injuries, especially for things like soccer and basketball, where there are a lot of knee injuries. As to activity in general, the Public Health Agency of Canada has good information on activity, as does the Arthritis Foundation in the US. Other things really basically is if you do injure yourself in sports, let's think about prevention, which may be not going back so soon, getting good rehab, physiotherapy, especially if a knee is swollen. Then these are the things that can prevent the osteoarthritis from developing when you're older. Well, preparing for surgery, total joint replacement surgery, so a knee or hip replacement, really is important. The total joint replacement surgery is not a walk in the park, especially for knee surgery, so that good preparation is going to lead to a faster recovery. What should you do? You should certainly be learning about the surgical plan, what's going to be happening to you, what the plan is for rehabilitation, how to change your home as you're going to be coming home and not really your usual self. You may also want to give a lot of thought to support. If you don't have a spouse, who's going to help you get through the day? Are there neighbors who will maybe drop in? These are things that can really help you and get you prepared so that you're in the right frame of mind when the surgery happens. Other things that are very important are often there's a wait from deciding that you'll have the surgery to actually having the surgery. So use that time well. Losing weight can make a difference. Losing even 10 or 15 pounds is going to help you recover faster. The other thing you can work on is both lower extremity muscle strength, which is going to be critical as they're going to want to get you up walking the day after the surgery, and upper extremity muscle strength, as you are likely to be using a walker and then a cane, and having stronger upper extremities is going to help you get going faster. Fortunately, there are some resources that can really help you prepare for joint replacement surgery. One of them is put out by the Canadian Orthopedic Foundation in their website. It's about 18 pages, very detailed, very helpful. Another one is called My Joint Replacement, which is also a valuable website to help you get ready. Just don't forget, it's not easy. It's going to take months and months, some people even years, to fully recover from joint surgery. So get prepared. I think one of the most interesting areas are the genetics of osteoarthritis. We know that about half of all osteoarthritis is due to genetics. We haven't been successful in explaining that half by finding genes, but certainly it's an area of intense research. And finding the gene may lead to understanding what's happening that causes the osteoarthritis, and therefore allow us to intervene with a drug or some other medication that could alter the course of the disease itself. Clearly, an area that I think we all read about in the newspaper and is coming but is perhaps not here yet is being able to grow cartilage. Early on, when we find osteoarthritis, there can be mild defects in the cartilage that if one could just fill them up, like using putty or plaster to fill a hole in a wall, the hope would be that we could regrow the very specialized type of cartilage that forms the cover for all of our joints. Finally, there's a hope, of course, that there will be drugs that can intervene to alter the course of osteoarthritis. Certainly, there's research going on in this area, But to date, it's been rather unproductive, in part because of the long length of studies that need to be done in order to demonstrate that you're really preventing damage to cartilage. Overall, I think probably things like genetics are going to help us understand how we can intervene for drugs, develop drugs, and there are new aspects of osteoarthritis, particularly hip osteoarthritis, where there's a lot of interest in hip deformity and very small hip deformities that may be causing the disease, and one may be able to prevent the development of the hip osteoarthritis by altering the exercise patterns of individuals with these deformities. So in that case, there's a great deal of hope.